Hi, Scott. It's good to see you. I'm glad we've got this opportunity to talk about the National Violent Death Reporting System. I know that North Carolina has been a long time participant in NVDRS. Why don't you tell me a little bit about what NVDRS means to you and to the state of North Carolina, and how you all have just remained engaged in the program for the past few decades?
Well, hey, Paul, it's good to see you. We've been fortunate. The state of North Carolina has had a VDRS program essentially 20 years now. We're going into our 20th year. And I would say that even more important today than it was at various points. But we've been very happy with basically what we've been able to kind of take some of that data and some of that surveillance and additional information around homicides and suicides and unintentional firearm deaths and really develop a very strong kind of advisory board and also a bunch of collaborative partners that we work with. Most specifically, we work a lot with the University of North Carolina Injury Prevention Research Center, but we also have a lot of new partners along with that collaboration. And there is a ton of interest at the moment around, as you can imagine, firearm related injuries and deaths. And so we've really been able to kind of leverage some of the work of VDRS in our state and hopefully continue to do some of that. But you got to remember, this is a different stage now than it was a few years ago. And I remember us having lots of little quick conversations and meetings. But maybe you can tell a little bit more about how things were started.
Yeah, absolutely. And you're right. We had some early conversations when the program was just in a handful of states. I think early on, we were working with 12 states that were part of NVDRS. And I remember the goal back then was really to just educate stakeholder organizations, educate policymakers about the fact that this program existed. And this program, at the time was in its infancy. And I think there was strong recognition and agreement within Safe States Alliance and some of our partner organizations on the need to expand the resources for NVDRS so that it could continue to expand to states across the country. Thankfully, this is one of those campaigns where we can now call this a success. NVDRS is now in all 50 states and a handful of U.S. territories. Yes, our job isn't done. We're still working to get additional resources because we recognize that the funding really isn't sufficient to provide the full support states need, given the fact that violent death rates continue to increase in states across the country. Yet, unfortunately, the funding from CDC has remained stagnant over the years. But I remember that early on at Safe States, when the organization and a handful of its members recognized that this needed to be a priority, that we established the student interest group on NVDRS. I'm sorry, we established the special interest group on NVDRS. And that was really the first time that we took a step towards organizing ourselves to ensure that we had a collective voice, a collective group of NVDRS states who were well positioned to educate members of the media, educate their stakeholders, educate policymakers about how the program was being implemented. And as you mentioned, Scott, the value of this data that comes into the state health department as a result of the NVDRS program. So maybe there are a few things you can say. I know you were involved in that early SIG. If there's anything that comes to mind about some of the work or conversations that you had back then, it'd be great to hear some of that.
Yeah, I think I was chair for at least a couple of years of the SIG, and I think what was important and great was that Safe States provided a place and an opportunity for kind of the current states and people wanting to become states and partners to just kind of have discussions about the importance of VDRS and how to kind of actualize some of that work. So the Joyce Foundation played a major role. I remember at many Safe State meetings we would have very dedicated time and space and bring together the various partners and kind of discuss the bits and pieces. I think we even advocated specifically back to CDC for a few kind of potential changes that would enable more states to participate, because I think some of the early versions of the NOFOs and the requests for funding were very limiting for a handful of states because they just couldn't get over the top, so to speak, or couldn't kind of get those agreements in place before applying, and also just having like a limited geographical area. And so that was really important to do some of that. But I also remember, going in. I think we've participated in most of the Hill Days since the very beginning that were BDRS specific. And I think those Hill Days really played a really critical role in that. And again, Paul, I know you organized most of those Hill Days. And, at various points, we probably, didn't know, like, well, we had some asks around, like, educating and advocating for our state, but also it was leading up to kind of some of the larger issues and needs that we had. Maybe you can tell us a little bit more about how you were organizing those or how you were thinking about those Hill Days.
Yeah, and first I want to thank you for your participation in the SIG early on. The Hill Day was really an evolution of that initial special interest group convening on NVDRS. That's when we recognized, hey, we do have a cadre of states members who are interested, who are willing to engage, and we do have a story to tell. We do have the opportunity to educate policymakers who truly back then knew nothing about the NVDRS program. So Hill Day really, as I said, became an evolution from the early SIG convenings, and we began bringing folks to Capitol Hill for a day, as I said, to really just educate policymakers about the public health utility that this program represents. And as we started to grow our Hill Day participation, given that those early discussions were not just with our states members, but as you mentioned, Scott, with stakeholder organizations as well, we began collaborating with national stakeholder groups with an interest in violence prevention, and they started lending their voice to our annual Hill Day. And so over the years, that event has grown. Over the years, that is the key event that has promoted NVDRS on Capitol Hill and has allowed policymakers to take an interest and to then furthermore take steps to ensure that the funds are there to continue to expand the program.
And it was helpful for us as a state as well, because again, I was bringing a lot of our partners and advisory board members and giving them kind of an opportunity to come to Hill Day. I think we had our chief medical examiner come one year. We had a chief of police come at one point. We had some of the researchers and some of the partners that we work with. So it was an opportunity for them as well to kind of go to some of the congressional offices and tell them about the importance of the work and kind of the ripple effect of it. So we had our state program, but then there were all these other programs that were benefiting or we were learning from. And then we were sharing more with our partnership groups and stakeholder groups. So that was really, really important. And again, I feel like it's even more important today. And I know we have a Hill Day coming up soon, and hopefully we'll be able to take advantage of that as well.
Yeah, you're absolutely right, Scott. One of the side benefits of NVDRS and something that I've heard over and over, again, not just at the national level, but from the states specifically, is the fact that NVDRS has really increased collaboration opportunities among injury and violence prevention professionals working in state health departments and those stakeholder groups that have an interest in firearm violence prevention or suicide prevention. Stakeholder organizations that today recognize the value of the data that's being collected through NVDRS. And so today have taken an active interest and are directly engaged in advocacy efforts on behalf of the program.
Well, I mean, I think states will, again, hopefully they're taking advantage of that and they see kind of the benefits of some of those things. And I think, again, as we expand some of these efforts, we're not only now even talking about, deaths, but even non-fatal injuries that occur for firearms through FASTER and hopefully sooner through the CDC AVERT program. And, it's a synergy between those two programs, let alone the comprehensive suicide program that CDC has and other programs where, again, they're kind of adjacent, but not, necessarily specific. And I think, again, we've been trying to leverage some of those, sometimes different partners or unique partners, and bring them into the fold, and also expose them to some of these other programs. But, again, I mean, I think states really need to kind of expand. We've been at the stagnant funding level for a while, and it's hard for, we've had increases. So the work is really increasing exponentially, and we have additional partnerships. So if we really want to capitalize on a lot of that momentum and some of that opportunity, we really have to make sure that we have, the partners that we have and the funding that will enable us to do some of that work.
Well, it's clear we've come a long way, and it'll be exciting to see the continued growth in the future of NVDRS in the years ahead.
Yeah, it's good talking with you.
Likewise. Thanks, Scott.